You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. If you are missing teeth or you are wearing a loose denture, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Rick Kline. Dr. Kline is the founder of Kline Dental Implant Institute. His practice is located in Houston, Texas, and draws patients from all over the world. We've invited Dr. Kline on the program today to discuss what you need to know if you are considering dental implants. Dr. Kline, welcome to the program.
Thank you for having me, Randy.
Now you are, and I'm glad we got you on the show. I mean, we've been after you for quite some time to talk about this topic. Probably the busiest guy in Texas when it comes to dental implants.
That would be true.
Good, good. Now, before we start, tell us about your practice.
Well, Randy, my practice is very different from most practices. It's a practice that's focused exclusively on dental implants.
Okay.
I do both the surgery and the replacement teeth on top of the implants.
Now, that's not how it's normally done. Is that correct?
That's correct, Randy. Most of the time, it starts with the general dentist that identifies the patient as needing dental implants. And they send the patient to a surgeon and then to another dentist to put the replacement teeth on top of the dental implant.
So why dental implants? In all areas of dentistry, I guess your practice is focused on dental implants.
We're entirely focused on dental implants. I've been doing dental implants for over 16 years and have done over 10,000 of these procedures.
What are the different categories of patients you're seeing that are coming in for dental implants?
Well, Randy, there are over 30 million Americans in the United States that are missing one or more teeth.
Okay.
Certainly the most obvious dental implant patient is the one that's wearing a denture. They have no teeth. And over the years, those dentures start to slip and slide around. So for them, dental implants are just a godsend. They're life-changing experience for these people. Other patients are patients that have an arch or a quadrant of missing teeth. They might wear a partial, and that's a lot of hardware in their mouth. So they want to get rid of that partial, and they seek dental implants. We also have a lot of patients that are missing just a single tooth. And instead of trimming down the adjacent teeth, they want to have, just one implant to replace that single missing tooth. And then also, Randy, there are the people that are kind of in denial. Their teeth are getting loose.
What do you mean by that?
Well, their teeth are getting loose, and they know they have problems, or they have extensive decay, and they may be getting ready to lose their teeth. And they come
I have
to
a friend like that. Their dentist says your teeth have to go.
That's usually a case for dental implants. They know they need to have the teeth replaced, and they don't want dentures. They've heard all the horror stories about the partials and dentures. They want something permanent. They want something secure.
So let's start with the one tooth. Somebody missing one tooth. What does traditional dentistry have to offer and dental implant? What's the difference? And why a dental implant? What's the big advantage?
Well, traditional dentistry, we grind down the adjacent teeth and put a 3-tooth bridge on that situation. The problem with that long term is a lot of times one of those adjacent teeth are lost and the bridge gets longer and longer and longer. The other advantage is that without an implant in the bone, there's nothing stimulating the bone or preserving that bone structure. So with a dental implant, you can put that implant into the bone, not touch the adjacent teeth, and have something that's going to preserve that bone structure over the years. Of course, Randy, the other category are people that maybe have a quadrant of missing teeth, and we use a few implants in those particular areas and put fixed bridges and give them teeth that are fixed back in those areas.
Why does it seem that people miss teeth in the back, lose their teeth in the back first?
Well, it seems like the priority, since they're not in front and not the public doesn't see that every day.
Oh, they're being extracted.
They're being extracted, and no one is offering them with implants to replace those teeth.
Okay. So with these people, again, what do you put in, 3 or 4 implants in the back?
Absolutely. It doesn't have to be one tooth per implant, but we use implants in an area, okay, and we have enough support for the jaw structure to replace those teeth, and then they can chew again in that area.
Any changes in the world of dental implants?
Randy, a lot of changes. And we're no longer using just regular dental x-rays to plan our dental implant procedures. With regular x-rays, we can only see the bone in 2 dimensions. And that usually involved making large incisions and a lot of downtime. And today, with the CAT scan, I can see the bone in 3 dimensions and even inside the bone. And what I use is a software that I virtually plan the entire implant case from start to finish, because I know where the tooth needs to be, and I know what the bone structure is, and it allows me to do a total planning of the case before we ever start. And what that does is allows us to do the implant surgery with no incisions and no stitches, and really it's no downtime.
So not all dentists are doing it this way.
No, most dentists are doing
I mean,
it.
nationwide, they're not. Some of them are just using dental x-ray?
Most are still using traditional dental x-rays.
Is that right?
Yeah, the CAT scan is certainly a new technology that the dentists are now learning to use, but I've been using it for several years now.
Should a patient demand that from their dentist? I mean, if they're going to be doing dental implants, what do they say?
Well, you know, I think, in my opinion, that they should be using CAT scans. The difference is like driving your car with a blindfold on without the CAT scan.
Okay.
It's that different. You know, I want to know all the details about that bone structure before we ever start the case. So the planning is critical in those cases.
So it's
and
all
that's
about
a huge advantage to the patients. You know, they can go back to work the same day. I mean, it really takes the fear out of having that procedure done for our patients.
You say you could do this in a day.
Absolutely.
How?
And even in an hour. While they're at the grocery store or the supermarket, you know, I can completely plan their dental implant procedure, and then we have very precise guides that I use, such as this, that goes right over the gums.
So what am I looking at there?
This is a surgical guide for a patient that once had dentures, and we're going to put 6 implants in that lower jaw, and I'm going to use this, and this was done using the virtual planning. This is going to go right over the gums, and I'm going to use this surgical guide to deliver their implants to the jaw, and then the teeth can be put on the same day or the following day.
How soon can they eat?
They can eat immediately after the surgery.
What about pain? Because when I think of dental implants, it seems like
it's
a
scary
painful.
for a lot of
The patients complain about pain?
No, not with this
Really?
new procedure. Most of them take just one Advil or Tylenol, and literally they could go back to work or their daily.
And that's new. I mean, that's fairly new.
That's very new.
Not a lot of guys doing it?
Not a lot. Not a lot. I've been doing it for several years because I was part of the inception.
So you teach that procedure?
I teach this to dentists, yes.
So what do you call it? Like flapless? It's not. You're not cutting.
It's a no flap, no incision dental implant placement. So it's called guided surgery.
Now most of these patients, I guess, are older, even though 70 today is young.
Absolutely.
But I mean, the healing process.
The healing process is much quicker because the patient doesn't have to go through that extensive surgery. So even patients that were once maybe not candidates for dental implants, were not healthy enough, now because it's not an invasive procedure, they can have the implants done and enjoy the benefits of having the implants.
Is that the main fear, by the way, that keeps people, these denture wearers, are wearing loose dentures, from getting implants to secure that denture, just because they're worried about pain?
They're worried about
pain. It's not something, I guess, to worry about, you're saying.
It's not. And for those fearful patients, we use sedation dentistry, which makes this a very comfortable procedure to have done. They literally don't remember any of the shots. They don't remember really anything about the procedure, and they're in a nice light sleep while they're having the procedure done. So for even the most fearful patients today, they can have this done and enjoy the benefits of having the implants.
Okay, let's start with the lower denture. What's the main advantage then?
That lower denture.
And how many implants? Let's start with the least amount to the, I guess, getting all your teeth back.
Yeah, Randy, the lower dentures, are a big problem. The lower jaw moves. We have this big muscle called the tongue that wants to kick that lower denture around. And that thing's almost impossible to control for most patients. So what the dental implants do, and even a few dental implants, can secure their current denture or a new denture in place and allow them to chew and eat. This is a good example of that. For example, this is a lower.
This is a lower denture.
Lower denture. And here we have just 4 implants that have been placed. And then we take the teeth, and they can lock the teeth in.
Okay, let me feel this. And how accurate is this, by the way?
Very accurate.
Okay. Now this is, I'm not exaggerating here. I can't even take it off. Okay. Do they have a tough time taking this out of their mouth?
No, even my arthritic patients, I can make them to where they can take it in and out.
So you adjust how tight it is?
Absolutely. And some want it very tight. Some people really want that secure, and I can adjust that for them.
So anybody watching this with lower denture, this procedure for implants snaps in, snaps out.
Great.
What about chewing? I mean, what
economical
can they eat? They have to be careful.
No, they can eat anything they want with that. They can go back to having a healthy diet.
I mean, corn on the cob?
Corn on the cob, you name it.
Steaks?
Steaks.
Do they tell you that? I mean, tell me what they say.
They say, Doc, you know, if I had to go back to having a denture again, I don't know what I'd do. I mean, they really are that attached to these implants and having those new teeth and the confidence that they have of having their teeth secured again.
One of the statements you made, you said, Randy, if there was a try-in period for these denture wearers, they couldn't go back to their denture.
There's absolutely no way they would ever go back to a regular denture or partial after having implants again.
What are the frequently asked questions? On day one, the denture wearer comes to you. What do they want to know?
You know, how long is it going to take? How much does it cost? And how much pain am I going to have to go through?
Okay. Is the pain usually the biggest fear? And we just talked about it, but...
Yeah, it absolutely is. There's a huge fear keeping people away. And really that doesn't have to be anymore. I mean, dentistry has progressed so much that people have these mental tapes in their head of bad experiences in their childhood or they have a friend or relative that had a bad experience with dentistry, and they play those tapes over and over.
My mother's 73 years old, pretty healthy. Mm-hmm. She has been wearing dentures since she was 28. I told her about you. She says, I'm too old. There's no way.
Never too old.
Really?
Man. Never too old. I mean, it is such a quality of life improvement. And this is done so simply and non-invasively today.
We've talked. You say this is the easiest type of patient for you, is a denture wear.
Absolutely.
I mean, it's a straightforward procedure, you're saying.
Very straightforward. I mean, it's no one, in fact, I stopped making lower dentures because it's damaging to the bone, and nobody really talks about that. And nobody's happy with them. Why do something for a patient that they're not going to be happy with?
When will this become mainstream? I mean, is this the future of dentistry where dentures will all be secured by a couple, you know, 4 implants or whatever?
At least a couple of implants are needed in all of these cases of patients with a lower denture.
What about mini implants? I see a lot of that in the news. What are your thoughts on that?
You know, mini implants are certainly better than a denture, but I really, in my practice, have focused on the traditional implants.
You think they're stronger? Well, obviously stronger.
I think they're stronger. You're able to chew so much better with the implants that I really think that you need their traditional implants to give the strength to your bite and to your
What about people that want all their teeth back, or they want something that's permanent?
Absolutely.
In their mouth.
And more. When I first started doing this back in 1995, more patients wanted the lock-in, lock-out style of teeth, and that's really changed over the last 16 years. Today, everybody wants their teeth fixed. They don't want to have to take them in and out if they can possibly.
How many implants for that? Because that sounds like the way to go.
Right. On the lower jaw, if they're missing all the teeth, it's as little as 5 and as many as 7 or 8. Yeah.
That's it.
It doesn't have to be 1 tooth per implant.
And some of these are that no cutting or no flap or what is the expression?
Well, it's guided surgery. 85% of the patients today are no incision, no stitch procedure, or the guided surgery. 15%, you know, we have to take teeth out and clean infections from the gums and bones, and they have to have the traditional procedure. In the upper jaw, usually for lock and lock outs, I like between 4 and 6 implants for the lock and lock out style teeth.
So what do you do for the upper? Same thing? I mean, we're talking about the same thing.
Yeah, they can have a lock in, lock out, and that gets rid of the palate versus a traditional.
What do you mean by that?
The palate of a denture, you know, Randy, let's take a look at this picture.
Okay.
A traditional denture covers the palate, which is the roof of the mouth on a person. With dental implants, with either lock in, lock out style or fixed style teeth, they don't have that anymore. So they can enjoy their foods. They have more room for their tongue.
Interesting. That's right. Okay, so their palate is covered.
The palate is covered, and there's some taste buds up there, and it takes away a lot of the enjoyment of eating when the roof of the mouth is covered.
So what do you do? I mean, you take it looks like a denture, and there's just snaps inside.
Absolutely. It'll snap right on and off, and there's 100 different, and these are tough to get on and off. They're that secure, but they'll snap right in. I mean, they rest right on this bar, and the bar puts the chewing forces.
Take a look at these snaps.
Sure.
Who does this? You send these out? You do
dental laboratory.
Okay.
I happen to use one of the finest laboratories in the country, Root Dental Laboratory, and they're amazing. They've been doing this for over 40 years. We have hundreds of different ways to secure these to the implants.
What about the look? You say you could make them look real. And I feel like I could spot a denture. I told you that.
Not one
You
of
know.
mine, Randy.
All right, all right.
You know, there's definitely an art to this. You really have to create a look for the patient that is their own. Each one is an individual creation. And I use input from the patient and the dental laboratory and myself, and we co-create these beautiful smiles.
You say it changes people's lives.
Absolutely changes people's lives. It gives them the self-confidence that they lost and once had and lost. We give them that back. They're able to smile again, to eat in public again.
Now, I don't talk to denture wearers about this, but are you saying that, you know, this is something that they don't like to smile big or laugh loud?
Absolutely.
I mean, are they
They'll
worried
put
their
their hand
dentures-
over their mouth?
They're
They
worried
put
their
hand over
dentures
their
going to
mouth.
fall out? Is that what's going on?
Absolutely. I mean, you can't understand this because you have a beautiful smile and you have all of your teeth.
Now, my mother is wearing a denture. I told you this. It's not
Right.
something she complains about. But do you think it's
They're
something...
silently suffering, and they put up with this for years. And they put it off for years because of fears and worries, but it doesn't have to be that way anymore.
What if somebody's taking medications? Can they be candidates?
Absolutely. Most of my patients, in fact, come in with a list, you know, this long of medications they've been on. And I work with their doctor and make sure that their doctor's comfortable with them having the procedure. And most doctors, even on patients that are on a lot of medications, can certainly have this type of procedure done. Randy, you really seem to be skeptical about how this changes people's lives.
Okay, okay.
Tell you what, let's take a look at some pictures and you be the judge.
All right.
You know, when this gentleman came to see me, he had a hard time in a business setting getting his point across. He was embarrassed about his breath, and he had a very high fear as an adult.
So when their teeth are starting to go, by the way,
Right.
that affects their breath.
That
obviously.
affects the gum disease.
Okay.
You know, their wife knows it. In fact, his wife was the one that was pushing him to come and see us because she was embarrassed, and because she knew that if she could smell his breath, people in a business setting could certainly smell his breath also.
So this was a guy that was diagnosed, your teeth have to go.
Yeah, his teeth had to go. Now look at the after. We've used
Huge difference.
Yeah, huge difference. But if you look at this, you can't tell that those aren't his teeth.
Yeah. Very nice.
You know, thank you. But we've used dental implants to secure the teeth and give him the confidence that he can go in as a business person and really talk about comfortably his thoughts in a business setting.
Do they say they feel more confident
Absolutely.
when they say that to you?
This was a total transformation in this man's life in being very withdrawn and inward to being very outgoing, and actually it improved his business success by having that confidence to talk to people.
So you do some very complicated cases.
That's pretty much the majority of what we do are very complex cases that need a lot of forethought and planning to get the consistent results that we're used to getting, and getting that person the function and cosmetics back that they're really looking for.
So if it's as good as you say it is, why isn't everybody doing it? Just afraid? They don't believe it?
Yeah, it's fear. Fear's a big thing holding people back, and
Afraid of the pain.
afraid of the pain and worried that and embarrassed that they to come and see me. They're embarrassed to come and see me many times.
These people don't want to smile.
They don't want to smile, and they don't want to subject themselves to such a personal situation.
Okay. You say you give people a chance to smile again.
Randy, let me show you another case.
All right.
This lady had lost all of her confidence in her smiling. You know, she loved to golf, she loved to be out in social settings, and she found herself being very withdrawn. If you look at the before,
She looks like a happy lady, though, even though those aren't the most
she's
attractive
a very
teeth.
happy lady, but she was concerned 'cause she knew deep down inside that she had problems, and she saw her mother struggle with dentures, and she didn't want to end up just like her mother. So
All right.
we had to clean up the disease process.
Gums you're referring to.
The gums, we used dental implants to secure her teeth, and that really put her back into the lifestyle she always enjoyed in her life. Now look at this after, Randy. We've made the two front teeth longer.
Yeah, they don't look like dentures.
No, we've broadened her smile. We've added lifelike gum tissue to this case, so when she does smile really big, no one will ever know that those aren't her teeth.
She looks younger.
She absolutely we take years off a lot of these people. Now here's another patient. She was absolutely terrified to come and see us. And when she found out about sedation dentistry, That motivated her to have her problems fixed. She was wearing partials, she had decay all over the place, and we were able to use implant dentistry and cosmetic dentistry to give her smile back to her.
So partials in the front area?
Actually, partials on the side. So we use just a few implants on the side and implants, and then we use some cosmetic dentistry around the arch to make everything kind of flow and give her a confident smile back. Now, look at these side by side. What's the difference that you notice?
Well, she looks younger.
Definitely looks
Looks
younger.
classier almost. Like more sophisticated. It looks good.
She's a different person, Randy. She's a different person. She comes across as a completely different person.
You like this, by the way.
I love
the dental
this.
implant thing.
I love this. You know, we're able to change people's lives every day. I get to go home every day.
They write you letters sometimes?
They write us letters. They bring us, cakes and cookies.
Okay.
They become part of our family. I mean, it's a different relationships than most dentists have. It's not a 20-minute filling where they run in and out. We get to know people. They get to know us.
And we're just about out of time. We have time for a few more photos.
Okay.
Probably 2 more.
Randy, let's take a look at this patient. Fear kept this woman
Wow.
away from the dentist.
I mean, is that common? Because her teeth are a mess.
Randy is very common. I mean, she smiles with her mouth closed. I mean, she has hidden this situation from friends, family. No one knows how she suffers on a daily basis. And you can see
Now,
that.
is this a person that just kept their teeth too long, in your opinion?
Absolutely. She held on to her teeth. That caused problems in the gums and bones. And it makes it actually harder for me when they stay away longer to help them, actually.
So what'd you do for her?
We had to get the teeth out, all of them, clean
right.
up the infections in the gums and bones. We used implants to give her teeth back and secure her teeth. And really, it completely changed the way this woman thinks about
Look at
herself.
this. I mean, we've got to put this on camera. Now, this is an extreme makeover. This is
an
a
extreme
huge
makeover.
difference.
Absolutely. It's more than just.
It looks like a dental model. I mean, she
teeth.
looks like,
But this
it looks great.
This is a normal patient in our practice. This is what we do. This is how we change the lives of our patients.
Now, when this woman sees her teeth for the first time, I guess in the mirror, are you there for that? I mean, what do they say?
Absolutely. It's
like
exciting.
emotional?
It's very emotional.
Why is
Her
it then I
face.
see these flat, straight, denture-looking?
And they look
Is
like
that just the
dentures.
hands in the
That's the
dentist?
hands of the dentist, absolutely. You have
Okay.
to be an artist as a dentist. You have to look at each person's facial structures and match the teeth to the person. And each one of these are custom creation just for that individual.
So denture wearers, you say their diet is compromised, and their health is compromised.
Absolutely.
How so?
The nutrition starts in the mouth. And if you don't have teeth that you can chew well with, you're going to tend to pick foods that are less nutritious, and you're going to have a less nutritious diet. And that affects their overall
Do they
health.
slowly just get away from, I guess, protein or whatever?
Well, they can't chew it. They can't chew the steak. They can't chew the chicken. They can't chew the salmon. So they make food choices, which are usually carbohydrates or starchy foods, because they're softer and they can chew those. And that affects their overall health.
So just 4 dental implants for a denture wearer, and they can chew a steak.
And they can chew a steak, and they can chew corn on the cob, and they can enjoy
Seems like everybody would do it.
Everyone should do that. Randy, can I show you one more case?
Yes, okay.
Okay. This woman had a removable partial, and she was in a public eye every day. She cuts hair, and she is close to people all day long, and she was struggling to keep her teeth in place. She needed implants. She wanted fixed, non-removable teeth. She was a young lady, beautiful woman.
Yeah.
But she really lacked the confidence.
So how many dental implants there?
In this case, we used about 6 implants in this particular case.
How long will they last, by the way?
Well, Randy, there's no limitation on how long they can last. Usually it takes a change in how people are taking care of their teeth, which we help teach the individual person how to take care of their teeth.
But they're in the bone solid. I mean, they could theoretically last forever.
Their lifetime.
Okay.
As long as they're taking good care of their teeth and gums, just like their own natural teeth. There's no limitation on how long these implants can last.
What are the misconceptions out there about dental implants that you hear that maybe drive you crazy? You just say, that's not true.
Yeah, there are many actually. Number one, I don't have enough jawbone for dental implants. That jawbone can be reconstructed, recreated.
Do you have material that you can add bone with?
Absolutely. We have a whole variety of ways now to replace that bone so the person can be a dental implant candidate. The other thing is you don't have to have one implant per tooth. You know, you don't have to have 14 implants to get your smile back.
Okay.
The other thing is that there's a lot of pain involved, and with sedation and guided surgery and some of the newer techniques, it is so less invasive that patients don't have to worry about that anymore. And it doesn't have to take a year or 18 months anymore to have their teeth replaced. You know, today it can be done in an hour or a very short period of time. I challenge anyone that's wearing dentures or partials or have missing teeth or are going to lose their teeth to come in and really sit down and
So get evaluated, I guess.
Get evaluated and let us talk to them about getting their teeth replaced with implants.
Interesting. Well, great. You know, very interesting topic. And I want to thank you so much for coming on the show.
Well, thank you, Randy. Thank you for having me.
Pleasure to meet you.
Absolutely.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview online or direct a loved one to watch it online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
There's a new secret to looking younger, an advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.